Rural hospitals are going broke under late reimbursement or taking a loss on Medicaid patients. The program has been under attack in legislatures across the Midwest for years. How can we stop this war on the working poor, children, and elderly?
Well, so the first thing that shouldn't have happened here in Iowa is they shouldn't have privatized the Medicaid system. To some extent, that was a transfer from Medicaid recipients to a managed care company who was hired to run the program. And that was a bad decision, and it was a bad outcome, and it hurt the citizens of Iowa. The problem with Medicaid here in Iowa is the same problem Medicaid has in most parts of this country, which is they don't reimburse enough. You know, nationwide, Medicaid only pays 80% of costs. So if you actually ran a hospital and all of your patients were Medicaid, you'd lose 20%. Right? That's a fundamental problem with Medicaid, which is one of the reasons I've proposed a universal health care system that gives every American health care as a right. You have a right to it. We can absolutely afford it. We're spending more money than anyone else. And it's also smart economic policy. You don't want people tied to their jobs. I mean, I started my business, and the only reason I was able to do it is we were starting a young family. I had 4 daughters at the time. But my wife worked at a firm that had health care. Otherwise, I would have been shackled to my job like so many Americans. So everyone should have health care as a right. It should be a mixed model. We have a basic government plan, and then the ability to have private insurance as supplementals or other options. And I'd roll Medicaid into that and have minimum standards for Medicaid that are similar to what's laid out in the Affordable Care Act, and do things like we do in Medicare. See, Medicare doesn't pay cost either, which is a little bit of a problem, but they pay 95% of costs. So I want to get those Medicaid reimbursement rates up as part of rolling Medicaid into a universal health care plan.